Hello, Prajita. Welcome to the show. We are a music therapy, and the topic for today would be based on music therapy. So, before starting, could you introduce yourself and what music therapy is?
Sure. Yeah, I'm a music therapist. I practice in Canada, in Toronto. And if I had to describe music therapy, it is primarily the use of music to achieve non-musical goals. But, that said, it is not just limited to achieving non-musical goals. Sometimes we might even use music goals to achieve a bigger clinical goal. So, for example, if the goal of a client is to enhance self-esteem, then we might work on learning an instrument because that would then help them feel empowered and independent in a skill, which then eventually will support their enhancement of their self-esteem.
Right.
So that is why it is very important to be a certified music therapist so that you can use music safely, ethically, purposefully within a therapeutic relationship that supports their health and well being. So, I would say overall, the definition of music therapy is still expanding, it's still evolving because so much more research is being done. But in the present, this is how I would describe it.
If you would have to justify the evidence supporting music therapy, could you throw some light on its support?
So there's, like I mentioned, there's a lot of research being done,
Mhm.
and anytime we do a session, we try to use evidence-based strategies that have been used and have had some outcome. So it's usually qualitative outcomes. So it's not necessary that if this worked with 10 people, it will work always with the other
Right.
100 people you try it with. So, but yes, we're doing research and seeing what's out there and what works, what doesn't work. Yeah.
So, is music therapy more effective in a group setting or an individual setting?
So, music therapy is conducted in both, like group and individual settings. But again, it would depend on the goals. So,
Right.
again, if I'm working with a child on the autism spectrum, autism is basically it's a developmental disability that it impacts individuals' emotional, cognitive, sometimes social, physical health. So they might struggle with social interactions. And if I'm working with a child who is on the spectrum and might be struggling with social interactions, then my goal would be to support and develop their social skills. And let's say being able to respect others, being able to just, function in a social setting. So now, if that is my goal, then at some point it would make more sense for the child to actually have group music therapy sessions, even if that group is as small as just two people. But that's where they will be able to practice those skills with the help of music and in a therapeutic setting. And that's when I would choose a group situation for a client or a patient. But
So
again, we have
when would individual one would be more suitable?
so individual would be more suitable when someone um, has a very emotionally heavy, intense situation that they need to sort of unpack and process. And there's lots of like it's anyway therapy means it's under confidentiality, right? Like it is an practice. We have to be very careful about that. So sometimes that content may not be relevant in a group setting. If someone had an instance of, let's say, as delicate as sexual abuse, then that can't be processed in a group setting because that could just be a trigger, a warning for somebody else. And so it depends. It again, it's also individualistic. Your therapeutic instincts would guide you where it would work in a group or where it would work in an individual setting. Yeah.
Like you gave the example of child suffering from autism. So, people who are suffering from mental disorders can benefit from music therapy, right?
Absolutely. Yeah. Like, I think music therapy can not only just help with mental illnesses, but
Mhm.
any issues, stress related, generally to improve quality of life because I mean it is music based after all. So I my short answer is that yes, it is helpful for anyone that needs it. Yeah.
How is it different from traditional therapy? And do you think that like one can integrate the two, or it is mutually exclusive?
So I think one very striking difference between traditional therapy and creative arts therapies and music therapy is that it can happen in group settings.
Right.
Usually, psychologists you won't have a group session, so that's already a big difference. And of course, it can be integrated. So I have often collaborated with psychologists, physiotherapists, social workers, when we're trying to generate a holistic care plan for the individual we all might be seeing independently. So, and for example, like stroke patients, one of the biggest challenges they have post a stroke is their ability to walk. It's largely affected. Most stroke survivors have weakened ability to walk. So, in music therapy, there is something called rhythmic auditory stimulation, where what happens is we synchronize movement to music, so rhythm to music. And because music is such a universal stimulant, people very naturally respond to it and very naturally coordinate their walking rhythm to the chosen song that they might relate to or might really appreciate. And that's one way to collaborate with physiotherapists. They can use this in an informed way, of course, with the support of a music therapist, but they can use that in their approach as well. So those are some ways where you can collaborate with other therapists.
Apart from stroke patients and those suffering from autism and other mental disorders, what are some of the other demographics that music therapy can take?
So there's so many avenues actually. People with depression, people with anxiety, in dementia care it is used a lot. People who have schizophrenia, psychosis. So there's a lot of largely mental health issues is where it started, music therapy. But now even corporates host workshops for stressed and burnt out workforce, and even a lot of college students are exposed to music therapy as a preventative way of, as a living in a qualitative way.
Right,
um,
right. Okay. So, like when I first came across music therapy, there were a lot of questions in my mind, and I'm sure a lot of people have them. Like, could you burst some myths related to it?
Yes, absolutely. So I think one of the biggest myths is that you need to be able to sing or play an instrument to benefit from music therapy. And like that's just not the case. Anyone and everyone can benefit from music therapy with or without a background in music. That's number one. And I think some people also think music therapy is the same thing as music teaching. But again, music therapy can involve teaching as a step towards achieving another clinical goal, as I mentioned earlier. But it's not the same thing, it's very different approaches. And another one that I want to add is that, a lot of people go into music therapy expecting like a quick fix to whatever they're going through, or, to have a solution. And while that can happen, it's not the most ideal way to look at it, because it's
Right.
not medicine, right? It's therapy. And it might lead to a situation where you don't need medicine for a specific situation. But again, the goal is therapeutic rather than medicinal. It is more qualitative and centered on wellness rather than fixing a problem. So I think those are some of the things that come up. Yeah.
Right. So, like, if we talk from the perspective of a client, how would their session look like?
So yeah, as I mentioned, earlier, music therapy is very individualistic. It looks very
Right.
different from one person to another. But I can give you an idea of a general structure of a session that, again, I follow. A lot of people might have a different approach. So if I'm meeting a client for the first time, I spend at least 2 to 3 sessions doing an assessment. And that assessment is what? It's basically, I have 6 parameters, which are social, emotional, communication skills, music skills, motor skills, and cognitive skills. So I'm just trying to see where they're at in all these areas. And
Right.
I do the assessment using music. So let's say if I'm assessing motor skills, and especially if I'm assessing fine motor skills where you use your fingers, then I would experiment with a lot of handheld instruments for my with my clients. So I would give them shakers or the piano to see how what their development is in that aspect. If I'm assessing gross motor skills, then walking, like I mentioned, with stroke patients, involving movement and music. And if I'm assessing emotional skills, then I would try to engage them in a series of musical improvisation activities. And that I would use as my base to analyze, like, how are they engaging in that activity? Like, are they playing really fast? Are they playing very slow? Are they playing in a shy way? So I'm just observing what's happening. Now, again, these observations are very subjective. Someone playing fast doesn't mean one same thing for everyone. You
Right.
could play fast and it could mean something, and I could play fast, but it could mean something else emotionally. Or, slow music doesn't relax everyone. I've had patients who want death metal music to relax them because they like that busy nature external to them and they feel safe in that internal of that heavy music. So again, so because it's so subjective, so I keep making observations and keep building a relationship with my client, and based on that, my session activities would evolve. And then we would determine two clinical goals that we want to achieve after the assessment. Sometimes we can decide together depending on their cognitive independence, or sometimes with their caregivers if they are not able
Right.
to, yeah, so, or I would independently decide. And music therapy sessions can be as long as 2 months or even as long as 2 years. I've had someone I've been seeing for 2 years, but of course, the goals keep changing over a period of time. So, just to give you a sense, that's what a session might involve. Yeah.
Right. What are the coping mechanisms that are taught to the clients? Like, is it only musical instruments that they're supposed to play in the time of stress, or other coping mechanisms are also in the picture?
Yeah, that's a great question because, of course, everyone can't afford music therapy also for, even if they can try it, they can't continue it. So I always try to give them some tools that, based on whatever we've experienced together, what has been most effective. So sometimes it can be as simple as building an intentional music playlist that is relaxing for them. Sometimes we don't know what relaxing is. So we together decide, like, is it sounds of nature that relax you, or is it like heavy death metal music? And then is it lyrics that relax you? Is it just instruments? What instruments relax you? Is it guitar? Is it sitar? It could be piano. It could be anything, flute. And then just on that, we'll together intentionally set up a playlist that can help them, and then they can reflect on these questions whenever they are in a situation that's really stressing them out. And I try to add music to things that we're already doing, like let's say we're just breathing every day, but if we can breathe to certain types of music which where like maybe their beat or the rhythm of the music is aligned to our heartbeat, right? So that already grounds us. So introducing them to those tools. So it would again depend, but yes, adding tools that they can use offline and not have to be in session for it. Yeah.
So, if someone wants to be a music therapy practitioner, is it necessary that they have to learn instrumental skills?
Well, so I think the general rule for wanting to be a music therapist now, I think even in India and North America for sure, is that you have to have some proficiency in guitar and piano and drums. These are the main three, because guitar can be it's an accessible instrument. You can take it with you anywhere, and piano also, because these are the most historically traditional instruments that have been used and people associate with. Everyone knows of the piano and so those three, yes, and of course we are expected to keep building our musical skills. Like we have to deepen our relationship with music if we want to be effective music therapists. So those three, yes, have to be there, and of
Mhm.
course keep developing other skills. Like I have also learned how to play a bit of the drums because sometimes it's so necessary for me to use drums in a session, or a little bit of the flute, basic. So yeah, just it's not like you have to be excellent at it, but you have to be able to know what you can do with that instrument.
And what educational certifications is one required to pursue if they want to be a music therapist?
So again, it looks a little different in North America and in India. So in North America, it's like you have to complete a bachelor's in music and psychology, where you have to have about 24 credits in psychology, so 8 courses in psychology, and you have to complete 1,000 hours supervised clinical internship, and then you have to write a licensed exam to be granted that permission to practice. So I think in India also there are colleges like in Chennai and even in Delhi where you can do a course, a postgraduate diploma in music therapy, and they also have an internship aspect to it where you
Right.
complete 1,000 supervised internship in a hospital or in a special needs school or depending wherever you want to be. And there's no requirement to write a license exam as yet in India. But yes, you have to go through that rigor of being supervised and working in a clinical setting for 1,000 hours to be able to practice.
What do you
Yeah,
feel is the scope of music therapy in India?
complicated question, but it's growing for sure.
Right.
It's very, like, of course, resources, as we know, is the realities. Like, it's
Mhm.
challenging. Everyone doesn't have the resources and even funding for music therapy jobs. So, like, one of the big things I realized is that, let's say in Canada, I can apply for a music therapy job. There is a job position. But in India, if you want to apply for a music therapy job, then they are open to it. But then you have to also, in most cases, bring funding for your position. So you have to reach out
Oh,
to channels, yes, to fund you.
right.
So it is definitely more exhausting, but not to say that this should discourage people because it is so effective. And in India, a lot of people now I see are very open to music therapy or doing adapted music lessons for people with behavioral needs or on the spectrum. So I do see growth because, of course, there is a market that needs it, but awareness is low. And once there is more awareness, I'm sure that will just grow and funding will improve and opportunities will increase. So
Right.
yeah.
And if someone wants to reach out to you for a service relating to music therapy, how can they contact you?
So they can email me. My email is aprajatasaxena8 at gmail.com. And I'm also on social media on Instagram by the handle of Travelization. And yeah, you can share those details. Yeah.
Does music therapy also help in those demographics who present social issues such as drug abuse or violence?
Yeah, absolutely. I have not worked with drug abuse specifically. I have worked with someone who had violent tendencies because, these are the things that we can see, like drug abuse and violence. But what we are in music therapy, or at least my approach, is to understand the causes that are leading to these situations where they have leaned into drug abuse to cope with something. So we try to use those as goals in our session, that what took them to that, right? Because there is a healthy way of dealing with our environment, and then there is unhealthy ways, which is like, drug abuse. Um, and so just finding those, what are those factors that are leading to that? And so, yes, music therapy has been used, and it can, like violence, for instance, the person I was working with came from a place of very low self-esteem. So it was a way to feel safe. Their violence was a way to, be heard, what they're trying to communicate. They just didn't know how to do it in a healthy way. And so to teach them those skills in a safe, therapeutic, warm, nurturing environment so that they can practice those skills in real life. Yeah.
Last question I'd like to ask you: what are some of the essential tools required by a music therapist?
So one is basically music, like your
Right.
proficiency in music has to be at a certain level. And voice, guitar, and piano are used a lot. So those three things, if yeah, that will be great. Um, and of course, studying psychology. I know it's not mandated in many countries, but it is. I see the power of that because then you can make connections
Of
on what's
course.
happening with the client,
Mm,
right? Like it's
right,
music therapy, and to keep deepening that, to
right,
keep updating with research. So I think those are the important tools because what I'm practicing today may actually become redundant in the next 2 years. So, and one part of maintaining my license is also to keep getting, I think, about 45 credits over a period of 5 years of continuing education. So that sort of, ensures that we are up to date with our
right.
skill set and what's happening in the world. Yeah.
So I'll stop the recording here. It was an honor to have you on the show.
Thank you. Thank you so much for having me.
Yes,